just want to make sure anyone hear me okay.
Yes.
Okay, good. Well, thanks everyone for your participation. Um, Also for the last time, that was a very good interactive meeting with the very excellent questions. So I appreciate that. That makes us feel that these presentations are actually helping, providing some insight and for the community as well. So one of the topics we taught, and then we're going to over with Dr. Gill today. How does it feel going through cancer, specifically with the chemotherapy? So I'm sure almost everyone, if not self, at some point had some contact or witness some sort of loved one or family or friend going through this process. And I'm sure they saw how physically and mentally can be affecting the life for a person and the family and the loved one during this process. So we're going to go basically see how it goes, what are things we can do, as far as if we know what's coming, that might actually help us to get through this process a little bit more smoother. And then things that we can help preventing it or managing it, or what would we expect. Um, so as far as the cancer goes, what has changed drastically for the past, I would say maybe more than 2 decades now, about the 2 decades, specifically more about the last 10 years, the diagnosis of cancer, it's been definitely changed. We do a lot more preventative medicine, a lot of new early diagnosis, as well as so many trial of the new medications coming, and then we have some achievement. Yet, therefore, we were able to have many of the cancer patients to live longer. So if this was about like 40 years ago, most people probably get diagnosed with cancer very late stages. That we do still happen nowadays too, but then the survival would be like much shorter because of the late diagnosis or because of the medication availability or the breakthrough things that we know now versus that time. That being said, nowadays the survival of the cancer is much longer than before. So basically, about 60% of the patient can actually survive up to 20 years, which is very significant compared to about like even 10 years ago or 15 years ago. The downside of this one is because we are able to give life, sometimes the quality of life may change, either because of the surgeries that we have for the patients or because of type of the treatment, the side effect of the treatment. Or sometimes it's just the way that a patient or someone goes through this mentally and dealing with it with a fight mode for a long time to get through it. And then some of the side effects may cause additional problems that we have to adapt to it as a patient, or may prone to have another cancer. So part of it could be because of the actual treatment or because of the cancer we prolonging the life, but doesn't necessarily mean that we could have a quality. That being said, we had a lot of successful stories as well. One thing I can just share right off the bat was we had a caregiver for our cancer patients toward the end. The caregiver herself was a 16-year survival of the uterine cancer from 16 years ago. That was at stage 3. So she was actually diagnosed 16 years ago, uterine cancer stage 3, and she survived and she's fully functioning and doing a caregiver for another person, which is a very happy story. Moving forward, so what is chemotherapy? So we hear about it as far as a chemotherapy, something with a chemical. Everything is chemical. So, for example, any medication is a chemical molecule. Even the water is a chemical molecule. So having a chemotherapy is just the name of it. But the main reason of this chemo medication is intended to destroy the cancer cells. How do they do this? They It's not that they go and find this cancer cell, is basically they looking for anything that reproduce much faster. So all of our cells in the body at some point die, and then before they die, they reproduce, become another cells. But then some of those cells kind of are long lasting. They may take months or a year to die and then reproduce. Some of them, they may go very faster. So the tumor cancers are the ones that rapidly reproducing. And the reason we call them tumors is because they're rapidly reproducing, causing a mass effect. They cause, they change the metabolism. They need a lot of energy. They affect the way that the body metabolism is. And then they become bigger, bigger, become tumor. So these medications basically affect to what we call the cell cycle. The cell cycle is the time that a cell started producing the next cell before it dies or become too for basically a new cells. So one of these medications are designed to act in a different part of the cell cycle to block those cycles so it won't reproduce again. That being said, when we do attack the body with chemotherapy, which usually goes generalized to all through the body, it not only affects this cancer cell, it may affect the normal cells as well, specifically the ones that they grow faster. For example, the hair, the nail, things that can basically die faster and reproduce again. So now we do use the chemotherapy in different type, in different stages. Sometimes we just use it to shrink the tumor before we want to go surgery and remove it. Sometimes we do surgically removing it, and then we do the chemo to eliminate the remaining of the tumor cells. And sometimes it's just like a pretty late stages. It's already throughout the body. So we're just trying to buy some more time by slowing down the progression of the cancer cell throughout the body. Usually, sometimes these cancer removal and chemotherapy could be curative, which is we can go under remission with no sign of any cancers afterward. And sometimes it's just the palliative. So basically, we postpone the process, we buy more time, which call it the palliative process. Chemotherapy comes with different methods. So as most of you probably seen is like intravascular. So we have an IV. People or patients go sit on the IV medication infusions with the chemotherapy, usually watch a TV for 3 hours or so. Some chemotherapy are oral, just taking a tablet, and so far like injection topical. Now, side effect of the chemotherapy. So as I was saying earlier, we do the chemotherapy for active reproductive cells, they do affect different cells that also have a very active metabolism and reproduce faster. So one of the area that cells reproduce more is the bone marrow. For example, the red blood cell of the body lives about 3 weeks. So the one that carry on the oxygen, every blood cells, RBCs, they live about like 3 weeks or so. So they have to reproduce faster to replace those dead ones. So bone marrow is one of the one that does it. So one of the effect of the chemotherapy would be acting on a bone marrow, so goes down with the low amount of the blood production. Hence, we call it anemia. Because of those, we can have malaise or fatigue as well. So not having enough blood can cause fatigue. Going through the actual medication, some of the medication cause fatigue by its own. Not to mention mentally, when we go through some sort of depressive mood, it can affect our mood and cause some sort of a fatigue and tiredness as well. Anything with some of those side effects of the medication can cause pain or discomfort that may affect our sleeping, hence also cause fatigue. After that, we have some nausea, vomiting that's very, very, very notorious for many chemotherapy that can cause nausea and vomiting. That's basically the way that act on some of the receptors of the body. It's part of the collateral damage. Same thing goes with diarrhea or constipation, depending of the pain or the way that the chemotherapy acts. Hair loss is almost everyone knows about it. Same mechanism. The hairs, they grow faster. The hair follicle, they produce faster, so they get affected really quickly and easily by chemotherapy. something we call mucositis, basically the mucus of the mouth. Uh, I'm sure many of you have noticed that when sometimes we have a lesion or something, or we bite, it's going to be very painful. So some of those cells die really fast. So that causes ulcers and lesion in the mouth, causes dryness and discomfort, sometimes pain from the chemotherapy. Definitely some reproductive that would be affected as well too, because germ cells of the body also act after reproducing very quickly. For example, sperm, it's pretty much all the times producing, and that can affect hormonal changes too as they shift the hormones. And also going through the chemotherapy physically as well as mentally going through this treatment and journey can cause affecting of the memory, which I'm going to talk about a little bit more, changing the attention, changing the way we think. It's very multifactorial from the way we sleep, from the way we get the medication, from the pain, from all discomforts. And sensory changes also something that Dr. Gill gonna a little bit talk about later too in the neuropathy, the way that it act on the pain and nerves. Any questions so far? Very good. So the next topic, basically one of the symptoms that we have is called chemo brain, or very easy way to say it's like foggy. There is no actual terminology was found for this cognitive impairment that happens during the cancer and chemotherapy, but the closest thing we can talk about is cancer chemotherapy induced cognitive impairment. So this impairment or dysfunction of the cognition that can happen sometimes even before chemotherapy, that happens, for example, we have a stage 4 cancer, that we have cancer cells metastatic to the brain that cause lesions in the brain and alter the way that the brain functions. Same thing with the chemotherapy. It has its own pathophysiology, which we're going to get through it. So basically, almost 75% of the patient with the cancer do experience some sort of the brain fog during this journey, and 35% of them after the chemotherapy. It's very understandable that they do feel it during the chemotherapy too, just because being tired and being fatigued by receiving the chemotherapy. So as I was just saying, so it can cause by brain tumor or brain mets or from the different treatment, including chemotherapy, including irradiation. One of the things that radiation does is trying to shrink the tumor by killing the tumor cells. And that killing a lot of cells at the same time can cause changes in metabolism and the things that is are released from the cells that can cause problem, brain fog, things with the hormone therapy, and even the surgeries. So this is like kind of sums the listing of the brain chemotherapy symptoms, sorry, the chemo brain symptoms or brain fog. We can see or experience some sort of a disorganized behavior or thinking. For example, if you have noticed something, maybe you have a deja vu, some of the feeling, oh, you've talked about this or not talked about this. The sharpness is gone. Sometimes you're blurry. You think about something, you can't get a clear idea. You become confused. Even someone who doesn't sleep enough can mix up the days or what days do they work. It is Saturday, Sunday. So that can happen really easily. Spacing out. So the timing, did I did this today right now, or like is it morning in the afternoon? Even though they can come back really quickly and then the patient can get back to the normal state really quickly, that moment of the spacing can become a little bit scary. The memory impairment is definitely a big part of it. It's usually the short-term memory. For example, anything from the past days, like, oh, did I take this medication or did I not take this medication? Or the doctor told me about these 5 different things. I remember 2 of them or 3 of them, but not all of them. Sometimes problem of recalling events, names, words, or figures. So you see your friend, and then as a patient, it's like, wait, I forgot your name. What was your name again? You know, sometimes there's a pauses to just putting words together to make that sentence. Same thing with trouble concentrating, paying attention. If a doctor comes, as we talk to the cancer patients, we make sure if we need to repeat things, we will repeat. We make sure they understand. We try to go section by section. Also goes with this slowing with the performing tasks. Sometimes patient with the chemotherapy may take longer to do things, may take longer to learn, may take longer to remember, may take longer to make decisions. It has happened before. Some cancer patients just say, you know what, I can't make a decision. It's just my brain's not being sharp enough to make a decision. Maybe you can do it tomorrow. Maybe you can talk to my sister, and then whatever she decides, then I'll do it. Difficulty choosing where I already just talked about it. Inability to multitasking. So basically, it sounds like kind of feel like a low Wi-Fi. So you were slow for downloading, analyzing it, or then wanted to respond. So if the Wi-Fi is too low, just downloading multiple different applications or like a website is going to be difficult. So it will be one at a time would be faster, and just pauses if we're going to do multitasking. Again, so tiredness, being easily fatigability, so become fatigued really quickly too. Short attention span, thinking about something and say, oh, I was going to tell you this, and it's just gone. So it's okay to write down and remember. And obviously the depressed mood too. For the pathophysiology, I looked actually, they cannot pinpoint exactly what is it causing it, but they kind of think about this like a multifactorial. So they did a lot of brain imaging to figure out what's going on. They saw this 70% of the patients, they do get affected with a high dose of the chemotherapy. So the chemotherapy also different agents, different numbers, or different intensities. So what they saw is basically they did a volume change of the different part of or the structure of the brain. They did find some sort of inflammation. Vasculitis is just the vessels that we have as far as like capillary, artery, veins. So the inflammation of those that can affect the blood circulation to the brain. As you see, so altering the blood flow. These reasons, for example, basal ganglia, frontal gyrus, cerebellum, these are the ones that actually do the high functioning, executive functioning with the processing. The information comes from the body, processing and try to make a decision before sending a response. So there's a slow of receiving, just if you have a slow internet to receive the data. Again, as I was explaining, there's metabolic oxidative changes that they found during this trying to figure out about the pathophysiology of the chemo brain or brain fog. The gray and white matter losses on the hippocampus, which is definitely is a part of the memory, specific the short memory part. And again, the white matter is the one that try to collect the information and process it before the response. Diagnostic testing for the chemo brain is pretty much what we do is symptomatically. So there's a change. We can see that the person or patient is becoming more slow in the process. There's no specific diagnostic we can do. However, because cancer patients going through a lot of different treatments and many different modality, it's important to rule out any other causes beside chemotherapy or beside the treatment. For example, if there is a new infection going on, if there is another like a drug interaction going on. So there is the whole lot of the workup we do for just to make sure there is nothing else going on beside the actual chemo brain, which is the nervous system affected by the chemotherapy. One of the other thing we can do is we can do a comprehensive neuropsychological testing, basically some sort of a mini mental status, things with remembering name, remembering the object. Can you repeat this? For example, have number 10, start deducting 7 and go down, see how we can do, having a word spelled and then spelled reverse. So we can have a number before the chemotherapy so we can get a baseline. And after chemotherapy, if there is changes or if a person start having these symptoms, we can have the person do this test to get the baseline of it and then see if there's a changes. That will help us if there's a change in the chemotherapy or medication that we can help, then to see if there is improvement or if there is a worsening of the chemo brain. At the end of the day, if this is indeed from chemotherapy, there's not much we can do unless to talk to the oncology to modulate probably or delay or postpone the chemo medication or try to use some adjunct medication same time. Going back to the management things that we can do or to teach the patient or if we are the patient, we can make sure that we have enough sleep and enough rest. We all know if we don't sleep enough. But I mean, if I don't sleep enough by the noon of the day, I'm probably gonna have some foggy. My functioning gonna be low. I would be kind of a slow down too. So when I was doing residency with the 28 hours or 30-hour shift, by far like after 26, 27 hours, the brain is pretty slow. It's not sharp anymore. We can suggest to eat veggies, basically clean food, try to avoid heavy meals, and whole burger with cheese and fries could be probably heavy to digest, or pasta. Stay on the clean side and diet. Stay physically active. This is proven for fact for any person staying physically active can help memory, a longer lasting memory function, as well as a better sharp executive function of the brain. We can do exercise with the brain that actually helps postponing dementia too, like doing puzzles, reading, learning a new language. So keep stimulating the brain, not to push too much when the brain can do it, like with the multitasking, but keep it engaged. Don't let it down to be deconditioned. We can use writing things down, like on your calendar, on paper, on the phone, smartphone. If you feel it's too overwhelming to put things in the multitasking, so we can just make sure to type these down. Again, avoid multitasking. We can set up follow-up routines to see if there's a decline or there's improvement. If we forget things, we lost things, we can try to have a specific location to put our things so they don't get lost. And be comfortable asking people to help you. If you really need help, some people, they just like, you know what, I want to do it myself. I want to might do it. So they don't want to get to the point I'm sick or I need help because they don't want to lose that anymore, which is completely understandable. But if you're sick, it's okay to get help. This sometimes is temporary. You go through the chemotherapy, you need help, you get the help, and you get better. Same things like with the surgery. I have knee surgery, I get help, and I get better. Track to see the memory problems if we have, if there's area we can remind ourselves more. And then at the end of the day, is the best is try not to think about it too much, because when we have a new setup, something happens, but we're constantly thinking that this is happening to me and it's destroying me. It's just gonna make things worse versus, okay, I got this happened to me. I understand that. I'm gonna work with it. My body needs me now. I'm going to work with my body. I'm going to reset my ability and then rebuild again. I'm going to quickly go over these medications. So for the chemo brain, because of the slowdown, we could use, obviously, we talk to the physician, you talk to your oncology as well as your palliative physicians. We call it stimulants. One of them is modafinil, and the other one is methylphenidate. Down one, these are the ones that actually increase some of the neurotransmitters, depending on serotonin or dopamine. And these are one of the ones that helps with depression too, or has a difficulty sleeping too. And then having more neurotransmitter, it helps the connection of the brain to be still go faster. So neurotransmitters basically in the neuron, they help transferring a signal from one area to the other area. So these medications help have more of those transmitters to help those transactions to be done faster. Donepezil or Aricept is another one with the acetylcholine neurotransmitter that not really necessarily help the speed of the brain, but overall postpone the dementia or the cognitive function in general. So these are the other listing really quickly, what happens during and after, kind of talked about it earlier too, but And Dr. Gill will continue on this one in more detail. So very quickly, we could have pain from the cancer, from chemo related. We could have fatigue. We just talked about it too. Physical deconditioning because we're in a bed for a long time, or we're not moving as long because we're tired, or we have to go to the doctor's office. We talked about the change in memory and concentration. Neuropathic pain, Dr. Gill will talk about it as well. Same with lymphedema, which is swallowing. Um, Mouth and teeth problem, as I was talking earlier, with the soreness that happens. Sometimes just a reaction with the medication that they have in the mouth. It just not taste good. Changing the weight and eating habit because of nausea. Sometimes taste changes from the chemotherapy. We can't taste the food, so we don't want to eat. Sometimes we have nausea, so we can't actually tolerate food. So the habit changes. So sometimes I like this food, but I can't take it anymore. And then I'll just do ice cream. Then it shifts. Trouble swallowing is another one that may come with multiple different reasons. Bladder bowel control problems too is another one because either because of chemo therapy, sometimes because of the pain management, sometimes because of the actual cancers. Menopause symptoms is one of the other ones. It could be very difficult to handle specifically for women younger, for example, 30s going through the breast cancer. Now they're going through the surgery and then chemotherapy. And because of the hormone related, they will have some early menopause. So they still having some discomfort from the surgery or the chemotherapy. And then they have to deal with the basically menopausal symptoms same time with the hot flashes and obviously emotional changes with depressed mood. So elaborating a little bit more on the fatigue, I initially spoke about it a little bit. That could be again multifactorial. The main reason is referred to the anemia, which is a low blood cell. So as I was saying earlier, when we have a chemotherapy attacked, the bone marrow cell, the amount of the cells being produced, it's going to be less. Sometimes during process with different some cancers, we may have some bleeding, some could be a loss of blood. That would be the major cause of the fatigue. It will affect the immune system. Part of the chemotherapy is actually lowering the immune system. So we won't attack, for example, if we have someone with leukemia, lymphoma, or need a transplant. So one of the things that to rebuild that is to make sure the immune system does not attack the transplant. Dehydration, again, or not having enough food can cause fatigue. Obviously, we don't eat that good because, again, from nausea, taste changes. Depression is a very big one. It's kind of a difficult at the beginning to handle, but it will get better most of the patients with the medication, a good therapy, and some results, actually, some promising future for that one. We can adapt with the chronic pain, having a chronic pain. Maybe there's a surgery, we have surgery, and that can cause some sort of pain because of the surgery, because of the tumor, and become chronic. Can think about, for example, a prostate cancer. It's a stage 4, but then there's a chronic back pain because it's already there and may take months up to a year or to take over the body. Sometimes if too much pain, we're going to go remove the prostate because just to help the symptoms. And again, poor nutrition, change of appetite, taste, mouth sores, nausea. Things we can do for the fatigue as far as the non-pharmacology. We can plan the day, and that way we make sure we have enough sleep if we need a nap time, so we can have that organize what we're going to do for the next day, save the energy as much as we can. If anything, for example, we need to go up the stairs or downstairs, the things that we can modulate somehow. If we need to do, like, for example, cooking or dishing that takes more energy, standing up doing it, we can sit down doing it. Those are with occupational therapy that can help with those. Short naps would help a lot. Naps, it's kind of a controversial. We talked about this the last time too. Depend on the people. Some people can really benefit, some people don't. So it works to try for sure. It does for me. This one is to try to sleep and wake up at the same time. So basically, if it's appropriate to sleep in the daytime, by all means, if it's too much and it would affect the sleep time, then probably not. And again, let other help you. So if there's something fatigue, if we can't carry this, if it's going to make me exhausted, think about the COVID too. When we had COVID, the fatigue would be very exhausting. Let people help you for time being. Let's choose again what to spend to energy on, what's matter, what's important. So we have those big things to that daily thing that we have to do to finish those to make sure we have enough energy for the day. And then joining a supportive group that does help with the venting or hearing other people. Sometimes just hearing how other people went through a much harder journey and they still doing good and getting through it. And that kind of it gives us a good a reflection that, oh, I can do this too. It's just, I'm just going to keep pushing. As far as the pharmacology or medication goes, similar to the ones that I was explaining earlier. So again, modafinil, and methylphenidate is another one, or Ritalin. These are the one that kind of a stimulant. So kind of push you up with stimulant medication. Think about the caffeine or coffee in a little bit in a stronger way, but they have a different sort of a mechanism action and different effect. And then the way we pick and choose is basically a physician job, depending on the symptoms.
Okay.
Any question at this point? Right. I'll let Dr. Gill take over.
Okay. Hi, I'm Dr. Gill. I'm again thankful for letting us do another talk. So I hope this is also helpful to all of you guys. We touched a little bit on this, but I'll talk a little bit more in detail about neuropathy. This can happen also during your chemo treatment, and sometimes it may get better for patients. But sometimes it can last longer, or it's something that doesn't go away at all. And usually we do see this in 30 to 40% of patients that get chemo treatment. Um, and sometimes it can happen because of the cancer itself, because of where it is and it affecting the nervous system. Sometimes it can also be because of the chemo itself. Usually tends to affect like, your hands or your feet, the areas that are furthest away, distal, not getting as much blood flow. They're not as close to the heart. So there are thoughts that maybe this is because of the treatment, kind of the chemo treatment, like depositing in those areas, or it's not flushing as well, and that kind of leading to that nerve damage long term. Patients can experience, pins and needles type of sensation. They can get, burning type of sensation, pain, or even numbness, feeling like, their hands or feet feel heavy. The next slide. Oh, thanks. And we just listed some of the medications that we commonly see associated with the neuropathy, causing peripheral neuropathy. So the common ones, vincristine, etoposide, most of the common ones that may cause it. And again, the picture on the right is just kind of reiterating things we talked about, the sensation. Like you can see on the drawing also that it's on the hands and it could slowly increase more towards your shoulders. Same thing on the feet, and it could get higher and higher. And usually tends to be symmetric on both sides. And pain, burning, numbness, tingling, which can make it difficult for patients to do things with their hands, right? Difficult to kind of really sense when they're walking. So we'll talk about things that we can do for next slide. So some of the treatments, so without medications, are going to be, continue to try to exercise. Physical therapy can be helpful, and that's something that your primary care doctor could help start that for you. There are studies using compression gloves, while you're getting the treatment to see if that's going to help. I think that's, still ongoing. It does show that maybe it does help. So that's something that you can also discuss with your oncologist if you have experienced these symptoms during treatment. If some of these things could be tried while you get the treatment. And then acupuncture can help. And acupuncture is also something that you would have to get multiple treatments and be consistent. It wouldn't be something that you do once and it may help. So you would have to stick to kind of doing it over and over to really see its benefits. Scrambler therapy, which they put electrodes on the areas that you have the neuropathy symptoms, like in the picture that you see in different areas. And they're basically trying to send like non-pain signals to your brain to make it think that you're not having pain in that area. Patients can feel relief from it, like after the treatment. After one treatment, you may feel minutes or a few hours of relief. So again, this also has to be done multiple times. Sometimes patients need like 10 different sessions to have longer lasting effects. And sometimes it can work to a point where the symptoms kind of go away and you're not feeling the pain because of it. It is, I think, at City of Hope, we don't have this currently, but I think if you inquire about it with your provider, your oncologist, or if you see us in supportive care, it could be ways to, see how you could get this therapy. I think we're working on making sure we have this available again for patients. Preventative things that are important are making sure that you wear good shoes, especially if you have neuropathy in your feet, because like we said, your sensation is not going to be as great, right? So you may not feel like a cut that's on your foot until it gets really bad. So as even in the house, making sure that you're wearing shoes and try your best to not fall. So if you already have poor balance and this neuropathy is going to make things worse, making sure that you use something to avoid falls, like a walker or a cane. And if you have symptoms on your hands, making sure that you're using gloves or other things, especially when you're cooking, because your sensation of hot and cold may be off. So you want to be careful touching hot things and sharp objects as well. Next slide. And these are the medication treatments that we can try. Some of the common ones are Cymbalta or duloxetine, which help with the neurotransmitters. And another class is anticonvulsant medications can be gabapentin, which we commonly use in patients with that have diabetic neuropathy as well, but also with chemo-induced neuropathy as well. And a lot of these medications, they do take time. You have to take it kind of consistently, and it will take a few weeks to start showing, its benefit for the pain. And if these medications are not working, then we would move on to opioid medications. And some of the other medications are like alpha lipoic acid, especially for diabetic neuropathy. It's an antioxidant, which can help. And usually also start with a low dose and slowly increase it. And that's something you can talk to your provider about as well to see. And you can do the alpha lipoic even with the gabapentin and see if the gabapentin alone was not helping enough. Next slide. And this table, we just wanted to kind of reiterate the guidelines that we generally try to follow as well, the NCCN, the National Comprehensive Cancer Network. And they're also covering the main classes that we just discussed in the table of antidepressants that, we can use, like duloxetine, and also anticonvulsants, like gabapentin or Lyrica. And some of the other things to also sometimes consider is topical medication. Sometimes we can get creams mixed with different medications that can help. but those can be sometimes hard to get covered through insurance, so they can be pricey. But that's something that can also be tried, and sometimes steroids as well could be tried. Slide. So one of the other symptoms that we can experience after treatment, or even during treatment, right, is pain. You can have generalized body pain because of the cancer and the treatments you've gone through. You can have pain if you had surgeries, scars from the surgery that can also take time to heal. And then we talked about neuropathy, so you can have neuropathic pain. And if you've had surgery for, amputation, or you had mastectomy, you may feel phantom pains because of that as well. And we do try to approach it with different, again, multiple different ways to treat the pain. One option would be medication. So we can do non-opioid medications, but also if that's not effective, like Tylenol or ibuprofen, then we would consider opioid medications. We can also consider, physical therapy to help if you need a brace that may fix the posture and then help with the back pain, right? And other interventions are nerve blocks, which can be really helpful. That we can get to have you see our specialist, interventional radiologist specialist, or pain specialist for us. They can sometimes do a block, also do injections for the back, which can help with the pain. And then again, other things to try, acupuncture, yoga, hypnosis. And I think the key thing is going to be, especially if we use medications, is having a pain diary where you can write down which medication you're taking, what was your pain like before you took it, and what is it after you took the medication, and then also trying to see if it's causing any side effects, right? And that information will be really helpful for your provider to see which medication is working better, or if we need to change something. And then also, it is going to be difficult, right? So you have to adapt to kind of a new normal, unfortunately, right? If you're having this chronic pain, realizing that you may not be able to get to a pain of zero sometimes, but our goal is always to get you to a level where you can still be functional. So I think that's an adjustment in itself, coming to that. Any questions so far? Oh, okay. So one of the other symptoms we can have is lymphedema, which you can see in the pictures, the swelling. And it can happen because if you're getting treatment for a certain area or radiation, the lymphatic system basically is not kind of pulling the fluid back, and it's herd spacing going into the areas it shouldn't, right? And usually we see this in patients that are getting breast cancer treatments, that have melanoma, prostate cancer, also cancer in the abdominal or genital areas. Big things are going to be making sure that you keep your skin clean, and doing exercises that could help drainage of the fluid. Things you could do at home is elevating if it's your leg or something above the chest level, wearing compression socks, which can also help so things are not just accumulating. Exercising can also help. And I think the other key things to remember is avoiding getting blood draws in that arm, if possible. And again, it could be because of your chemo, it could be because of the radiation, and our blood vessels are not working as well, so things are kind of leaking out into the space. Sometimes if the lymph nodes themselves are removed, right, because of the surgery that you needed, and then that's why you can have accumulation as well. So there are also wrapping that you can do to the arms, and maybe some of you've heard of the lymphedema clinics. where they can kind of teach you those things if that's needed as well. There's also medications if we really need to, diuretics, which can kind of help you pee out and get rid of the fluid. But we want to try to do these other things as well, instead of just the medications to help. And other things we see are, trouble swallowing, which we also call dysphagia. And that commonly is seen in patients that get radiation to the head, the neck area, the breast area, or the chest. And usually the recommendations is going to be, we want to make sure first you get evaluated, right? That you talk to your doctor about it. They may have you see a speech pathologist who can do a swallow eval and let you know, what kind of food or textures are safe for you to take. And they may have you do a swallow, like official swallow test with like x-rays and stuff. That would be the next step. But basically evaluating that and then seeing what types of foods are better for you to take. So sometimes soft foods are going to be better, like puddings or soups. Using a blender kind of more often to kind of have that soft consistency in food that you eat. And then also making sure that you're drinking water, and you can carry a water bottle with you, for your appointments and stuff too. Just kind of reminding yourself to take a few sips here and there, which can also help with the continue to swallow as well. Other symptoms are going to be like menopause symptoms. So we do see that women, because of the treatment they're on, sometimes can stop getting periods regularly or altogether, right? And sometimes we see this in medications like tamoxifen or raloxifene. So you can have irregular periods because of that. You can have hot flashes. You can have decreased interest in having intercourse. You can also have fatigue or sleep issues. And you can also have memory issues, mood swings, like depression, as well. And some of the key things to remember, especially because of the chemo treatments, in women especially, right? So that you can have, because of these changes in your cycles, you can be at risk for bone loss, right? So, and most of the oncologists usually automatically do this. They may be ordering something called a DEXA scan to assess how your bones are doing. So that's something to make sure that you get done. And if for the symptoms themselves, doing things like using cotton sheets if you're feeling really hot and sweaty, avoiding spicy foods, trying to avoid alcohol or caffeine because that may also interrupt your sleep, decreasing, quitting smoking, and then exercising. And there are sometimes medications doctors can also use to help with these symptoms. But that would just depend on, the current treatment that you're on and what's okay to take or not. So that's something you can always discuss with your provider as well. Next slide. And I think we've touched a little bit on this already. Other things are body changes. So especially if you are a patient that's gone through, mastectomy or had to have an amputation, it is a lot, right, to go through, and then just realizing that your body has gone through so much, and giving yourself the time to grieve. That's okay. We're only human. Our emotions have to go somewhere. So giving yourself time for that, recognizing that as well. And other things that can help patients are, wearing a prosthesis, and making sure that it fits well. And sometimes insurance will also pay for this. So, always ask your provider to help you with that. And other ways to kind of enhance your experience, your appearance, haircut, changing your color, changing the clothing, anything that's going to be more comforting for you, because things you may change, what you liked before to now. And then sometimes these things, even though they may seem small, may help you feel better overall. People can also experience changes of their skin color because of the radiation. And there are, you can always talk to your doctor more about it. If you see a dermatologist, what else that you can use to kind of help with those skin changes. And the other, I think, important issue to discuss is, can you go to the next slide? Is intimacy. And that can be also because of different type of cancer that you've had and the treatment, especially in patients with prostate cancer. They may have difficulty with having erection or sustaining it, or issues with ejaculation. So it's important to, these things can be hard to talk about, but it is important to talk about these things with your provider, because there are medications that could help, or certain treatments that could help. And this is going to also affect your overall health with you and your partner, right? So make sure you talk to your doctor about it. For a woman, there can be vaginal dryness because of radiation. Sometimes the scarring and everything, the vagina could become smaller. So they always recommend using dilators during treatment and even afterwards. So making sure you're doing those things. Sometimes better to use lubricants as well. And also Kegel exercises that could help if you're experiencing incontinence symptoms. And then we talked about the menopausal symptoms that women experience, which can then also affect intimacy as well, right? And I think the other big thing with cancer treatment is also going through, treatments can cause infertility. And this is something that usually oncologists will also talk to you about based on the treatment you're getting. So making sure, thinking about it in advance, and if you need to do, egg freezing or anything, do that before you start treatment. That's also something to think about. And again, reaching out, talking to your doctor about if you need to see a psychologist or a counselor or someone that can also help. And then opening up to your partner, talking to them about these issues that you're having as well is important. Next slide. And then bowel and bladder issues. Also, if you have gone through prostate cancer, colon, rectal, you can experience these issues. There is physical therapy that can help with this as well, and Kegel exercises that you could do at home, and if needed, medications as well, because this can be really upsetting and it can be difficult for you to return to work. So there are ways that we can help. So also good idea to talk to your doctor about it. For mouth and teeth problems, usually seen in patients that are getting chemotherapy or radiation, especially to the head and neck area. And it can have, sores in the mouth or gums. It can affect your saliva glands, so not producing as much saliva. And there's like the big box that is mainly for prevention, things that you could do, keeping the mouth moist, keeping it clean, and avoiding things that would make it worse if you have sores, right? So avoiding alcohol or spicy or too sugary things, acidic things, which may make it worse. And for medications, there's also like magic mouthwash, other things that we can use to help with these symptoms. Okay, so I wanted to leave a few minutes for questions as well, so we have 5 more minutes. But that's the end of our talk. We kind of generally wanted to go through the big things and, the other, as much as we could cover during and after what you may experience. So I hope all of that was helpful. But if anyone has any questions, do let us know.